Ladies and gentlemen, the celebration of the 5th anniversary of the NICU will now begin. Please enjoy the program.
In the midst of a global pandemic and with doubt and uncertainty surrounding us, we're here today to celebrate. 10 years ago, a new neonatal ICU was a dream, and 5 years ago, each of you made it a reality with the opening of the Drs. Rouben and Jiji Neonatal Intensive Care Unit. Because of you, in the last 5 years, 3,357 babies received expert multidisciplinary care delivered by board-certified neonatologists, fellows, incredibly skilled and compassionate nurses, physical therapists, occupational therapists, pharmacists, speech and language pathologists, nutritionists, social workers, and many more. Because of you, parents no longer need to adhere to visiting hours, but they can stay with their babies at all times. And because of you, 96% of these babies have survived. Your investment in our work has yielded groundbreaking results. And on behalf of our tiniest patients and their families and each and every member of our team, we thank you. We are so glad that you can join us today to celebrate the many successes that the neonatal ICU has achieved over these last 5 years. And part of our celebration today, it's my pleasure to introduce Dr. Bert O'Malley, who is the new president and CEO of the University of Maryland Medical Center. Dr. O'Malley, who's a renowned otorhinolaryngologist, joined us on November 1st, and he's already hit the ground running. For Bert, this is actually a bit of a homecoming, as he previously served in multiple leadership positions here at the University of Maryland Medical Center and School of Medicine from 1999 to 2003. I'm delighted to have Dr. O'Malley back with us, and I look forward to working alongside him. At this time, I'd like to turn it over to Dr. O'Malley.
Thank you, Allison. It's an honor and a privilege to join you today in celebrating the 5th anniversary of the Drs. Rouben and Jiji Neonatal Intensive Care Unit. I echo Allison's sentiments. We cannot begin to thank you enough for your steadfast support of this important program at the University of Maryland Children's Hospital. I can recall back in the early 2000s, there were discussions then about the need to renovate the NICU into a space that could provide a true family-centered experience with an emphasis on great patient care and outcomes. The updated NICU reflects this and much more. It is incredible to see firsthand the transformation that has been made thanks to each of you. Every critically ill baby and their family deserves access to the very best complex care, and that is what the Drs. Rouben and Jiji Neonatal Intensive Care Unit provides. I look forward to hopefully meeting you in the future, and please know that our hospital doors are always open.
There is just one Drs. Rouben and Jiji Neonatal Intensive Care Unit. Within this Level 4 NICU, babies born prematurely or with medical complications receive expert care around the clock. Now we mark the 5th anniversary of this new space at the University of Maryland Children's Hospital. As a state-of-the-art facility, it was designed with a focus on every feature needed. With 52 single rooms, as well as a family lounge, it is easy for moms and dads to be with their babies. With 250 people, including 160 nurses, working tirelessly here, the number of babies coming to the NICU grows each year. Last year, almost 800 babies were cared for here. And with a 96% survival rate, so many are able to go home. In the 5 years the Drs. Rouben and Jiji NICU has existed, close to 3,300 families have experienced firsthand the sophisticated and compassionate care we offer. And for those families, the day they take their baby home marks infinite possibilities for the future.
When you picture giving birth, you have these kind of diaper commercials in your head where they bring the baby and you get to hold the baby. One night my water broke and we immediately went to the hospital. I was only 27 weeks, so we weren't expecting to have to deliver that early.
I mean, I don't think either of us will ever forget really how small they were at that time.
They were born so early, we didn't get to hold them, and it was actually a week before.
I don't want to play with rubble.
Before we got to hold them.
As you can see, I mean, it is, from where we were at that point to 4.5 years later, I can't believe it. Andrew was in the NICU for 3 months, and Stanley was in the NICU for 6 months. To say it was a roller coaster would be an understatement. There were times that we thought everything was headed in the right direction, and then the next day you walk in, just something that you can rarely believe. And they both had situations where, that blue call button was pressed and the room was, flooded with 20 people. So it was definitely, the most emotional and trying, process I think that we both have ever been through.
Being able to have the individual rooms, I think was a treasure for us. We were able to, pull back the curtain if we needed some privacy, or, just spend individual time with our children, not having to be kicked out at a certain hour of the day. We actually had friends who were in another state. They had a different program, and they were telling us how usually it's in a room with all the babies together, 10, NICU children, and I couldn't imagine, how much more difficult that situation is when you already feel so exposed and you already have so little control. So it was just great to have that space. And our boys were actually in the twin suites, so they were in rooms next to each other with a door that opened between, and so we were able to quickly, go back and forth between the rooms. And one of the greatest things was the first time we all were able to hold hands as a family, because each of the boys were connected to different tubing that was connected to the wall. So we made a chain so that we could, in the twin suite, through the open door, all of us be able to hold hands as a family for the first time.
It was a pretty big moment.
You just don't know what to expect day in and day out. And so the doctors and the nurses really, as much as possible, put you at ease, because they've been through that situation before, and they can explain, what potentially to expect. We were very much, trying to be engaged and getting a lot of advice from the nurses on things that we could do, even while they were in the isolates, to read to them, to sing to them. One of the greatest things about our experience was having this new therapy programs where they helped us to sing to the kids, to feel comfortable singing to them, and doing, hand gestures and understanding their gestures as well. And so having that opportunity to feel a bit like a parent in a situation that feels very sterile and the opposite of parenting was great to have that program to teach us how to interact better. And there were also many programs to get the families into a break room together to do crafts for the kids. Anything to get us, to get your mind in a positive place and connect with the other families. So that was a really great opportunity. And we made, we met a lot of families that helped us with that, what we could talk about together that only our families were experiencing. So it was a good way to get to know people. As much as we were so lucky to have the NICU and all of the nurses and the doctors who helped us, we were thrilled to walk out the doors.
And it had been over 160 days at that point with Stanley. So I think, too, we had, after a certain time, you almost lose concept of time of how long you had been there.
We're just so grateful of our outcome, grateful to have him home.
We are honored that you have made time in your busy schedules to celebrate such an important milestone with us. The 5th anniversary of the opening of the Drs. Rouben and Violet Jiji Neonatal Intensive Care Unit. I feel confident that both Jiji doctors would applaud the decision of their stewards, Stacy and Rick Hoffman, who led the way for this renovation. To Stacy and Rick, our continued heartfelt thanks, and to all of you who joined them in making this renovation take place, thank you so very much. You made the dream of a new NICU a reality. 5 years ago, we had a vision of a new NICU, one with individual patient rooms that allowed for constant visitation, one with a family room where new moms and dads could share their hopes and fears, one with a family consultation room where news, both encouraging and tragic, could be shared in private, one with offices and spaces where staff could regroup and refresh. Your gifts made all of this happen. And what has been the result of your investment? The numbers speak for themselves. During these last 5 years, we have cared for a total of 3,357 babies. Not all of these babies were born here. Some were transported here. Your generosity allows for babies from across Maryland to have access to expert neonatal care. Medical advancements and research from here have resulted in innovative treatment of complex medical conditions such as prematurity, congenital heart disease, respiratory distress, genetic syndromes, metabolic disorders, and surgical conditions. Your support continues to dramatically impact the daily lives of our tiniest patients, their families, and our dedicated staff. We can never truly thank you enough. Here's to another fulfilling 5 years.
Hello, and welcome to our live panel discussion in celebration of the 5th anniversary of the opening of the Doctors Rouben and Violet Jiji Neonatal Intensive Care Unit at the University of Maryland Children's Hospital. I am Dr. Brenda Hussey-Gardner, and I am thrilled to be here with you this evening and moderate this celebratory event, which recognizes our most steadfast supporters and acknowledges the incredible work of our Jiji NICU faculty and staff. I am an associate professor in the Department of Pediatrics at the University of Maryland School of Medicine, the developmental specialist for our unit, the director of the Maryland's Premature Infant Developmental Enrichment Program, and co-director of the Jiji NICU follow-up program. I have more than 25 years of clinical experience working with the babies in our NICU and the toddlers that they turn into in our follow-up program and their families. As shared in this incredible video, the opening of the Doctors Rouben and Violet Jiji NICU has truly transformed our delivery of patient care. Our Jiji NICU is one of 2 NICUs in Maryland with a Level 4 designation, which acknowledges the highest level of medical expertise currently available. This level of excellence has been sustained by innovative research, cutting-edge approaches, and an astonishing 96% survival rate. We have an exciting and informational program for you this evening and look forward to sharing with you our achievements over the past 5 years. Each of you played a big part in our success. Before I introduce our panelists, I want to go over a few housekeeping items. Each panelist will give a brief introduction and share their experience with the Doctors Rouben and Violet Jiji NICU. This will then be followed by a live panel discussion. After our panel discussion, we will open it up for questions. On the right-hand side of your screen, you will see a chat box. This is where you may submit your questions for the panelists for the Q&A session. You may submit your questions at any time throughout the program, and we will try to answer as many as possible. It is now my privilege to introduce our expert panelist. Dr. Stephen Zinn is the chair of the Department of Pediatrics and the director of the University of Maryland Children's Hospital. Dr. Dina El-Metwali is the division head and medical director of the Doctors Rouben and Violet Jiji NICU and an associate professor of pediatrics at the University of Maryland School of Medicine. Dr. Unsung Cho is a neonatologist and assistant professor of pediatrics at the University of Maryland School of Medicine. Dr. Cho is also the medical director of the NICU follow-up program. Teresa James is the nurse manager for the Doctors Rouben and Violet Jiji Neonatal Intensive Care Unit, and Natalie Hunt is a neonatal nurse practitioner with the Jiji NICU. At this time, I would like to invite each panelist to share a few words about themselves and their thoughts on this milestone anniversary. Let's begin with Dr. Zinn. And Dr. Zinn, if you could unmute your microphone, please.
Thank you, Brenda.
You're welcome.
To everyone. It's great that you're spending some time with us today. As Brenda says, I'm the chair of the Department of Pediatrics as well as the director of the University of Maryland Children's Hospital. And honestly, I have the best job in the world. I view my job as being a conductor of a world-class orchestra made up of incredibly great nurses, staff, physicians, and trainees. And we're all working together to be the best children's hospital that we can be and the best children's hospital in the state of Maryland and beyond. I work very closely with leadership from the medical center as well as the School of Medicine to identify strategic programs that would improve the care we can provide. And the Jiji Neonatal Intensive Care Unit is one of those programs. I want to also point out that as a result of your fundraising and support for this NICU, I also am honored to be the Rouben and Violet Jiji professor. So that was just an incredible honor for me to be to hold the seat of the Rouben and Violet Jiji professor of pediatrics. You've heard a little bit about what the NICU does and how important it is to us, but I want to just end by saying thank you to all the donors and just let you know how transformational your gifts were. Not only are we providing the best possible care to families throughout the Mid-Atlantic region who have a premature baby, but this has become the center of our children's hospital. The NICU is where we take all of our physicians that we're recruiting. It's where we take all of our visitors. It's where we take all of our guests. And it has totally transformed the level of care that we provide throughout the entire hospital. So this has been a gift not just for the families of Maryland, but it has been a gift for the nurses, the staff, for all of the physicians. And each and every day, we recognize the value of this NICU, and thank you so much for your generosity in making this happen.
Thank you, Dr. Zinn. Next, we have Dr. Dina Elmetwali.
Hello, and welcome, everyone. I am Dina Elmetwali. I'm the division head of neonatology and the medical director of the Doctors Rouben and Violet Jiji NICU. I have been with the University of Maryland for almost 10 years, and I was actually appointed as a medical director to lead this project. I had the opportunity and the privilege of doing this. Well, the NICU opened in 2015, and time flies by. I can't believe it's already the 5th anniversary. But this vision, and I'm not going to call it dream because it is a vision and it was made true and could only happen and continue to grow because of all of our donors that are with us today. I want to let you know that you have touched so many little ones. I want to let you know that your shadows were present behind every life we saved, every disease we conquered, and every smile on the parent's face. Thank you.
Thank you. Thank you very much, Dr. Metwali. Dr. Unsung Cho?
Thank you, Dr. Hussey Gardner. As Dr. Hussey Gardner mentioned, I am an assistant professor in the Department of Pediatrics at the University of Maryland School of Medicine, and attending in the Jiji NICU, and also the medical director of the Jiji follow-up program. I am honored to be a part of tonight's panel with all our esteemed guests, and would truly like to thank all our donors for their generous support. It really has been a privilege to work in the Jiji NICU for the past 3 years, and I look forward to continuing to bring smiles to the faces of our parents, of our babies, and all our staff as well.
Thank you, Dr. Cho. Teresa James?
Good evening. My name is Teresa James. I'm the nurse manager in the Jiji NICU. I have had the pleasure of working here at Maryland for the last 33 years. And I would say approximately 30 of my years have been in our NICU. So I've had the fortunate experience of coming from, this is my third NICU. I have definitely seen, the I've definitely seen the transformation of what we can do with all the new technologies and all the healing practices. We are certainly one of the most esteemed NICUs in the state. We are very often called upon to take tours. And in my words, I would say we are the Four Seasons of the NICU of actually the US of A. So thank you for all of your generosity. It is greatly appreciated.
Thank you, Teresa. And our last panelist this evening is Natalie Hunt.
Hi, thanks, Brenda. My name is Natalie Hunt. I'm one of the neonatal nurse practitioners here in the Jiji NICU. I'm also the director of the Cuddler program that we have here in the NICU and a member of the NICU neurocritical care team. I've been here at Maryland for a little over 8 years. So I was in the old NICU and have had the pleasure of being in the new Jiji NICU. And it's been such an amazing transformation. And like everyone else has said and spoken to, the care that we're able to provide to our babies in the state-of-the-art NICU has just been amazing. So thank you to all the people that have helped us get to where we are. And I'm so excited to see where we go from here.
Thank you, Natalie. Now that we've had our introductions, I'd like to move on to our panel discussion. And the first question that I have is for Dr. Zinn. Dr. Zinn, can you tell us about the transformation from our old NICU to our current Jiji NICU?
Well, thanks, Brenda. I think that the video briefly mentioned our old NICU, but imagine one of the most exciting times in the lives of a family, the birth of a new baby. And in that moment of joy, getting the message that your baby's premature, your baby has a medical issue, and you need to be transferred to a neonatal intensive care unit. The mixed emotions, the excitement about the new arrival, the fear, the trepidation, and you enter a unit where there are 9 other babies in the room. We've always had the greatest nurses and greatest physicians. We've always had cutting edge technology to provide care. There's never been an issue with the care we provided. But what was very clear is that in those moments when parents were struggling with all those emotions, they needed more than just the best nurses and physicians. They needed some privacy. They needed a chance to collect their thoughts. And that's why we pushed for this new unit. The new unit is actually not that much bigger than the old, but it's 3 times as large. This was the biggest piece of real estate that the medical center ever committed to a project, 36,000 square feet. Not only did they commit that space to us, but they allowed us to go to visit units throughout the country and take the best ideas of each of them. And the hospital never refused any suggestions, any requests. And what we put together is nothing short of remarkable. It is 5 years old, but it still is one of the best and well-planned, thought-out units in the entire country. It's a model for what a neonatal intensive care unit should be. We have visitors coming through from other hospitals who are looking to build NICUs. We have phone calls. And when we give tours, as Teresa said, people are amazed when they see the detail and love that was put into this unit. It's really the most incredible piece of architecture I've ever seen. What it's done for the children in the state of Maryland, it's allowed us to take care of these kids within the state. We no longer have any babies that need to be transferred out of the state for their care. They can all come here. We have an outstanding transport service. Our volumes have gone up. And when we built this unit, it was a 52-bed unit. And there was a lot of discussion about, are we making it too big? Will we be able to fill it? What if we can't fill it? What will we do with the rooms? 6 months into it, it was full. And 5 years later, it continues to run full each and every day. So once again, your gift continues to make a difference each and every day. Thank you so much.
Thank you, Dr. Zen. Dr. Elmet Wally, how has the Jiji NICU impacted you, the Division of Neonatologies, and the families you serve?
Thank you, Brenda. So the new design, the private design, is actually a general trend and a new trend in healthcare, which is focused on families, family satisfaction, their privacy, and the feeling of individualized care. So this new private NICU helped babies in many aspects. Even infection, it decreased the rate of infections because being in those rooms, there is more focus on hand hygiene and definitely less time of hospitalization if they don't get infected as often. And even data has shown that the rehospitalization, which is being readmitted again, this rate has come down. It's less noise, it is less, and noise, I'm not talking about sound only, I'm not talking about good noise like music, for example, or reading a book to your baby. I'm talking about the alarms and the alarm fatigue. This has all went dramatically decreased compared to the crowded open bay NICU. I don't know if you know that this NICU promotes parents to be with their babies and increase kangarooing, breastfeeding, and studies have shown that for every 1/3 of an ounce of breast milk, there is an increase of almost half a score in intelligence. We are talking about half an ounce, 1/3 of an ounce. So you could multiply this of how much breast milk could really help with the brain development. Add to this, that just for the mothers to be there, studies have shown that for every extra 1 day of visitation by mothers, this increases intelligence by 3 points and increased language by 5 points. These are things that are incredible for those premature babies in particular when their brains are evolving and they are maturing. For our staff, it has been an incredible opportunity of satisfaction because it's long hours of the night. It's big efforts, and you see how it's worth it. When you saw those babies coming back or seeing the pictures that were on today, it's just incredible. It's worth it. It's worth years of studying. It's worth nights being up. It's worth being sleep deprived because this is the real worth in life to see this happening. For me, I cannot be more proud for this wonderful opportunity that I was given. And I just can't be thankful enough for every one of our donors who had this happen, made us live the moment, made the parents happy, the children healthy. And again, I can keep on saying thank you enough, and those words are not enough.
Dr. Matwali, could you tell us a little bit about the accolades received by the Jiji NICU and the medical team to date?
Oh, so there's a lot of those. I have to say the first big Jiji NICU award that we got was in February 2016. This is pretty much was like, 4 or 5 months after we opened the NICU. This was a national award from the Intelligent Healthcare Association. These are very prestigious awards given like once a year. And we got this for developing special phones to communicate between us and labor and delivery. And those phones were developed even more for nurses as they go for breaks to receive the alarms on them. So this was published data, was an amazing experience and an honor for every one in the unit. We got recognition from national recognition for our role in combating and helping babies, withdrawing babies who are exposed to opioids through their mothers. So we have families. We are family-centered. It's baby and mothers, and we had an award for this. We were recognized for our nursing leadership, the DAISY Award. We were recognized by the Joint Commission. This morning, and maybe our team know, we had the state visit for our redesignation as a level 4 NICU, and we were named a role model for quality metrics for data and statistics. So the honors fly by, and they are just humongous. And I want to say there is an honor for every staff member, every faculty, every fellow and trainee that works in this NICU and devotes their time and commitment. They are heroes, and that's an enough honor.
Thank you very much, Dr. Metwally. It's wonderful to hear about all of the accomplishments to date. Dr. Unsung, could you please tell us a little bit about the NICU follow-up program? What happens in the Jiji NICU follow-up program, why it's important, and the impact that it has had?
Yes, thank you, Brenda. So our Jiji NICU follow-up program really aims to provide ongoing evaluation and guidance related to the development of our most at-risk infants, namely our NICU graduates. We monitor them for the first 3 years of life to make sure that these children are developing to the best of their abilities. We're only able to see patients once a week at this time, but we still have over 800 visits annually. Most infants are at ages 4 to 6 months of life, and then we see them every 6 months after that until the age of 3. All of our infants and children are screened using the Best Beginnings developmental screen, which was developed here in the Jiji NICU. The screen evaluates developmental milestones and also the quality of that development. Referrals are also made based on our screenings to our pediatric subspecialties within the Children's Hospital, to infants and toddlers programs within the local counties that the patients come from, and also to Dr. Badawi, who is one of our developmental pediatricians for babies and children that require ongoing care. Our families, I think, are quite happy and thankful with our Jiji NICU follow-up program. We've had amazing parent satisfaction surveys that have consistently demonstrated that close to 100% of parents and families are truly happy with the developmental portion of the program, and overall satisfaction is also excellent as well. We've been providing care to many babies across the state of Maryland, but due to a recent significant increase in capacity and in demand, we've been actually exceeding our capacity to see patients and have recently only been able to accommodate patients within our University of Maryland practice. Also, in part due to our experience with our Jiji NICU graduates and the NICU follow-up program, there have been recent changes to the early intervention regulations to capture more of these at-risk NICU graduates that may be at risk for developmental delay.
Thank you. And Dr. Cho, can you tell us a little bit about how the NICU follow-up program has impacted you personally?
Well, personally, I am thankful that we are able to provide this follow-up care to our most vulnerable patient population graduating from the NICU. I have to say, one of the best parts of my job really is seeing these babies and families come back, the babies that we took care of that were so sick in the NICU, that everyone was pouring their best efforts into, and they come back looking wonderful, meeting their milestones, being happy, and just seeing the smiles on the parents' faces and also of our patients as well. Just today, we were, Dr. Hussey Gardner and I were in NICU follow-up, and we had a patient who was one of our sicker babies, born quite small, and required a lot of support. But today he is just a 18-month-old toddler running around, playing with his sister. And when we asked Mom, what makes you the most proud about your child's development so far? And she just couldn't stop first smiling and then started crying tears at how thankful she was, at how well he was doing, and at how far he's come, and really wanted to thank not just our staff and physicians in the NICU, but everyone that participated in taking care of him. And again, none of this is possible providing the best care that we can provide. As Dr. Zinn said, we have the best nurses, we have the best nurse practitioners, we have some of the best physicians, but now, we also have had this amazing physical space, technologically advanced space to be able to provide that excellent care.
Yes, Dr. Cho, I can speak from experience with you. It is just amazing to see them when they come back to NICU follow-up and hear parents reflect on their time in the NICU and how far their babies come. It's a real honor to be able to follow them. So thank you. Next, we have Teresa, a question for you. Can you please tell us about the programs and activities offered to our Jiji NICU families?
Oh, yes. We have a actual group of parents who had babies here in our unit. We have a NICU advisory panel is what we have titled them as. In this group, the parents work with other disciplines or our interdisciplinary team to make decisions for our unit. They actually had a very integral part in deciding on some of the activities and the layout of our unit and some of the floor plan models of how we were going to actually design our unit. Our parent panel, they also are very involved in making decisions about our visitation, in addition to some of the activities that we have planned with our families. We have weekly activities that we plan with our families. A couple of our nurse leaders actually lead the group to set the design for those different programs for the families. Typically, we have something every season. During the winter, there may be a holiday event. We recently had a Halloween event. We have a winter season coming up. It's not necessarily a religious event. We just call it a winter holiday season. And then in the spring, we have like a spring photos for some of our families to have like a little photo shoot with the babies. We also were very fortunate to be a part of a program with Mother Goose on the Loose, where our parents are actually taught how to read to their babies, to developmentally appropriately handle their babies, and provide the actual amount of stimulation appropriate for the baby's gestational age. So the programs, we also include events for dads. That was one of our newer events where we started a dad support group. And we also started a support group of a parent-to-parent panel. I think we did that twice this last year, where the older parents or the previous parents were able to come in and provide support to the current panels or current parents panels. And that was a great success. So I think the way we have it set up, we also have a lot of community involvement with the parents while they're here and where they feel like they're one big family in our family lounge, where they're able to share their stories. They're able to, just provide support for one another so that they're not feeling so isolated in their individual rooms. They're given a chance to, be a little more support to one another at difficult times and even during the happy times. So we do a lot with our families on a weekly basis.
And that's something I've seen be a real transformation from our old NICU, where there just wasn't room to bring families together, right, and you couldn't do things. So it's been a wonderful thing to see. And Teresa, on behalf of all the families, thank you for offering those activities to them. They really do enjoy them.
Our parent lounge was really designed for the parents to have a place where they could come and kind of just relax and relieve some of the stress of being at the bedside with their baby during the really critical times. And in the parent lounge, I found that our families are really able to just breathe. And that space allows them to just, have that exhale and enjoy a moment. We do crafts there. I mean, they do a lot of things in the parent lounge, and it's a great support for the families.
Absolutely. And Teresa, can you tell us about the achievements of our excellent Jiji NICU nurses and a recent special publication of the Journal of Neonatal Nursing?
Sure. So our NICU nurses, I love to brag about our nurses because, of course, I think they're fabulous. We were recently the third year or the third designation. We were very involved with the magnet designation here at University of Maryland. We also had several nurses who won the award for the Daisy Award. I believe we had 3 of those in the last 2 to 3 years. We recently had a photo publication of one of our most critical babies I believe we've had in our NICU. She's on the cover of the Neonatal Network for this upcoming month. We've also had, this is another really big one, the Baltimore's Best NICU nurse was one of our nurses, Michelle Davis. She received that award in the spring of 2020. So I am very proud of our nurses and the work that we've done, and I really look forward to what we're going to accomplish in the future.
Thank you very much, Teresa. Natalie, you've been involved with the Cuddlers program in the Jiji NICU. Can you tell us more about that?
Yes, the Cuddler program is something that we were working on maybe a year or so before we moved into the new NICU, but we wanted to wait until we got into the new NICU where we'd have the space, the single rooms for families to really be able to implement it the way we wanted. So putting the Cuddler program together was a multidisciplinary effort. We had people from the neonatal medical team, our developmental specialist, Dr. Hussey Gardner, help from social work, pastoral care, rehab therapy, much input from our NICU Advisory Council, where we had the parents also give their input, because we certainly wanted to make sure that the parents would feel comfortable with this program, since it is volunteers coming to spend time with their babies. So we certainly wanted their input, and certainly the help from the foundation and donors to help us get the program up and running, getting input from some help there. I know Stacey Hoffman was in our helped us with putting this together, and Ann London and her family have donated books that we give to our NICU babies, so that the volunteers have reading material, and the families also are able to use these books and read, and have something to read to their baby while they're here visiting in the NICU. So it's something that we had a big team to put together and implement in our NICU. Each baby is able to get a bag of books that's donated. Ann Lynn and her family put the books together, and they developed bags for the books. And we're able to give each baby and each family a set of books to kind of help with starting that first library, that they're able to take those books home as well. And they also get a log that when the parents do come, they're able to fill out the log and give them some information about things that their babies like, books that they would like them to read. So that when the cuddlers come in to spend time with that baby, they're able to see what the parents' input is, so that there's some communication between volunteer and parents, so that the parents also feel involved, even if they're not able to be there as much as they would like to. So we usually have volunteers, in the community, and they come, they do special training to be a cuddler. They come in and they learn how to provide appropriate neurodevelopmental care to our babies. It's just a few hours of training that they come in and do. They also follow a NICU nurse around to see how we interact with our patients and our families. And that's all part of their training before they go out and cuddle with the babies themselves.
Thank you, Natalie. And I know you're involved in the Cuddlers program, but are you involved in any other activities that you would like to share with us?
Yes, thanks, Brenda. I'm also a member of the NICU neurocritical care team, and that's also another multidisciplinary team that is comprised of folks from neuroradiology, our neurologists here at the Children's Hospital, our medical team from the NICU, our developmental specialists, again, in rehab therapy. And what our goal is with this program is to be able to provide consistent and coordinated care for our newborns that are at higher risk for brain injury, being from babies that are born extremely low birth weight to those that are born and have asphyxia. So we put this team together, and we plan to use approaches that enhance early detection and diagnoses of these potential brain injuries, so that we hope to be able to improve long-term outcomes for these babies. And it's nice in this NICU, we have state-of-the-art facilities here in the Jiji NICU, such as AEEG with seizure detection, video EEG, MRI. We have sound monitors in the room. So all these things we're able to use to be able to provide that targeted special neuro-care to our babies that are at higher risk for having brain injury.
Thank you very much, Natalie. It's nice to learn about that program as well. We will now begin the question and answer portion of our event. So if you have not already done so, please feel free to submit your questions for our panelists through the chat box. Again, as a reminder, it's located on the right-hand side of your screen. But I've already received several questions. So the first question is going to be for Teresa, Dr. Metwally. Is 24 weeks of gestation still the defining time for survival?
It's actually 23 weeks. There are some hospitals that would resuscitate a baby as small as 22 weeks, but this is not standard of care. It's still evolving, but 23 weeks is the cutoff.
Thank you. And then another question, and it will probably also be going to you, Dr. Metwally. And the question is there one major advancement in neonatal care that has made the most significant difference?
Well, I would say surfactants, because they call in neonatology the pre-surfactant era and the post-surfactant era. If you remember, the Kennedys had a baby that did not survive because he was born premature. And he was not even anything close to a 24 or 23 weeker. So surfactant is, it is this substance produced by the lung that helps the lung to expand. And when it is produced in the late part of pregnancy. So when babies are born earlier, they don't have it. So since it is available now that we could give it to the babies through the breathing tube, and it helps the lung mature and help those babies survive. But it's not one thing, because babies could survive but have a lot of handicap and disabilities. And it is everything that we're doing, and all the stuff like Natalie Hunt talked about, taking care of the environment, of the neurodevelopment, the ongoing research that is going on to find other stuff that we could help the babies with. I mean, our team are advantaged, having all the support from you guys, the Schwartz Awards and for research. We have people like genius people working on very important stuff to make those babies healthier. Look at even the very small things. It's not just survival now. It is survival and being healthy.
Thank you. And this next question goes to possibly Dr. Zinn or Dr. Metwally. And are there recent advances in prenatal care that help determine which mothers should deliver at University of Maryland Medical Center so their babies can be served by our NICU right away?
So maybe I'll start, and perhaps Dina can follow up. One of the things that we haven't talked about is that in addition to the new NICU, we have a very well-organized labor and delivery program. And within labor and delivery, we have the Center for Advanced Fetal Care and a maternal fetal medicine program. So during the first few months of a pregnancy, as the obstetrician or the midwife examines the expectant mother, there are lots of opportunities to do ultrasounds and potentially identify issues. And if there are any issues that are identified, or if there's a family history of babies that were born and did not survive, we have an expert team of maternal fetal medicine physicians that can address those issues very early on. And they're very quick to call a consult from our neonatology expert team and set up a plan of action for that family, so that as that pregnancy progresses, they know that there's a plan in place. They know that they are being monitored closely. They know that if they need a bed in our NICU, it's available to them. So this is really a team sport. We have the NICU, but labor and delivery is critical to this whole process, and our maternal and fetal medicine docs are the best in this state. So, Dina, if you have something else you'd like to add.
Just pretty much, Dr. Zain, what you mentioned, I just put a plug in for the role of the NICU in community outreach. So we spread to the community, we visit the community hospitals, we make them aware of programs like the CAFCA, the Center for Advanced Fetal Care that Dr. Zain just mentioned. We are there to support them, to guide them. So it's not, we extend beyond the boundary of the Jiji NICU. And the Jiji NICU with telemedicine is equipped with the highest, even before COVID and everything. It is equipped in a way that we reach out to everyone. We give them the support until the babies are here. And we also give the support of which mothers, particularly for the question asked, which mothers are to follow up in this advanced level of care versus they could stay in the community, and when to come to the UMLC.
Thank you very much. And this next question goes to Dr. Metwally and Teresa, and then also Dr. Cho. So Dr. Metwally and Teresa, if you could talk about what your major challenges are moving forward with regards to the Jiji NICU, and Dr. Cho, if you could speak to major challenges regarding our Jiji NICU follow-up program.
I think one of our biggest challenges right now is dealing with COVID. One of the big dissatisfiers, or I would say one of the disheartening things that we have to deal with would be our visitor restriction in the pandemic. We are one of the most open NICUs in the country. Prior to COVID, we allowed parents to stay overnight 24 hours, 7 days a week. 4 parents or 4 visitors were allowed at the bedside. And with the pandemic, as it is now, we had to really restrict our parent visitation. And I would really say that's the biggest challenge that we face on a day-to-day basis right now is this visitor restriction. It is really sad for us, sad for the staff, all of the staff. It's sad for the families. And there's nothing more that we can do to try to keep one another safe, keeping the parents safe, keeping the staff safe. It's just overwhelming, really sad for us.
Thank you, Teresa. Dr. Metwally, would you like to add to that?
Again, COVID is a difficult time, and we are all in this together. But I think this is an opportunity. It is challenging, it is difficult, but I want to tell our donors, we got mothers close to babies. There was one shot that was displayed that showed this mother who was intubated during her last month of pregnancy because she had severe COVID. She had the baby, was born by C-section. Baby came to the NICU, but she was still intubated for maybe another 10 days. And when she was extubated, she couldn't come to the NICU. And because of the donations of the mobility carts with the Zoom access and those very high definition cameras, you could see the look on those moms on this mom's face as she was looking for the first time, really, to see her baby after being so sick and close to death. And I can't speak enough to those moments, how precious they are. It's difficult times, but again, I want to emphasize your role in supporting the NICU, because those devices were donated even in 2018, before all of this happened, and we were one of the very the few institutions that were ready for this. And I can say I was on the listserv for division chiefs, and they all reached out to ask me about our experience when I showed the photos of what we have. So it didn't only contribute to health in Maryland, but it helped people with ideas nationwide.
Thank you. And Dr. Cho, what are the most challenges facing the NICU follow-up program?
I think similar to the inpatient, our Jiji NICU, COVID has been challenging for all our outpatient programs as well. Fortunately, we've been able to adapt, being able to use telemedicine to reach our vulnerable babies and our graduates and their families. In addition, I think, outside of COVID, the most challenging issues that the Jiji NICU follow-up program is facing is that because of the increased demand and because of our limited time, we've had to scale back on the number of babies, or the total number of babies that we're able to see, in that our visit numbers have remained the same, but we're only able to offer them currently to babies that are within our University of Maryland system. So I think that would be our biggest challenge, not being able to truly serve all premature or sick babies graduating the NICU to be able to follow up in our NICU follow-up program.
And Brenda, can I add, it doesn't have to be a new challenge. Even continuous improvement is so important. And the way we serve our babies is by research and science and evidence-based medicine. Research has a great role in paving the way for better practices. And this will be an ongoing need to advance research and advance healthcare for the babies.
Thank you. And we have one final question that each of you can respond to, in 30 seconds or less, given we're approaching the 7 o'clock hour, but it's an important question that came from one of our viewers. And it is, what are the most pressing or significant goals for the NICU that donors can help support? Research. Teresa?
I would say research as well. We are actually embarking upon one of our first nursing research activities within the next 2 months. And it's going to be actually very interesting to see how it plays out. We are looking at what's called the Get to Know Me board for the families, for us to get to know our families. So we are working with our nurse scientists to actually do some research in that area in the neonatal world.
Thank you. Dr. Cho?
I guess I'll go with research as well. We're able to follow most of our graduates for a minimum of 3 years. So we have a lot of data and a lot of information that we would like to be able to expound upon and hopefully be able to help our future babies and families. And research and any support that we can have would be very helpful achieving that goal.
Thank you. And Natalie?
I'll mimic my team here and also go with research. Especially, we've seen a big increase in the number of researchers and nurse researchers, DNP students coming through the School of Nursing at University of Maryland as well. So we're kind of increasing our numbers on those that are interested in research within the Jiji NICU. So I think that is a big thing for us.
Thank you. And Dr. Zinn, what would you say?
Well, you've heard that research is very important, but I also think that follow-up is equally important. And as you heard, we have a NICU follow-up program. But that NICU follow-up program is not able to provide follow-up for all of our graduates from the NICU. We do an incredible job of educating families, of treating the infants, of getting them healthy enough to go home. But the first 3 years of life are critical. And the NICU follow-up clinic is very important, but we could double or triple the size. And most importantly, the NICU follow-up clinic is a requirement of all NICUs throughout the state of Maryland. If you have a level 3 or level 4 NICU, you need a follow-up program. And so there are many graduates from NICUs across the state that are not able to get into a NICU follow-up program. This is the future of our state and of our country. And so that would be where I would think resources could be used very wisely.
And Dr. Cho, do you know how many NICU follow-up programs are serving all level 3 and 4 NICUs across the state?
So it used to be many more, but currently there are only 2 NICU follow-up programs, one of them being the University of Maryland Jiji NICU follow-up program, serving the entire state of Maryland. And as Dr. Zinn mentioned, because of this decrease in programs, but the increase in number of babies that require follow-up or deserve follow-up, it's been difficult for us not being able to provide that care to all the babies in Maryland.
Thank you. It is now 7 p.m. and I would like to thank our panelists and thank you, our donors and our audience, for joining us this evening. We are incredibly grateful for your support and your generosity, which has allowed us to achieve so much in the last 5 years. In the next day or two, we will email you a link to this webinar. Please feel free to share it with your friends and family. For any questions we were unable to answer this evening, we will send a follow-up email in the coming days with answers to those questions. Within our follow-up email, we will also provide contact information if you would like to submit any additional questions, and we would be more than glad to answer those questions for you. I wish you all a wonderful evening and a healthy and safe few months ahead. Thank you for joining us.
Thanks, Brenda.